So let's get right into it. So as I mentioned earlier, a symposium titled Healthcare Quality in Trinidad and Tobago Models for Best Practice. It is expected to take place on April 21st. Joining us on set to tell us all about it are Professor Raul Naidu, Professor of Dental Public Health and Chairman of the Planning Committee, and Dr. Rian Marie Extavo, Lecturer and Associate Dean, Public Relations, Faculty of Medical Sciences. Welcome.
Thank you.
Morning.
Good morning.
So we have this exciting conference to talk about. My first question, what are the objectives of this conference?
Well, I think our main objective is to really create a forum for all stakeholders in healthcare to discuss the issue of quality. It's something that affects all branches of health, from education right through to research, administration, delivery, and patient care. So we believe that everybody involved in healthcare has an interest in delivering high quality healthcare, and as patients, they must be right to expect high quality healthcare. So that's what we hope to be able to make some impact through showcasing best practice and models for best practice.
Yeah. Is it the first time that we're having something like this in our country?
No, this is the second one.
Okay.
There was one, I believe, in 2013, and it was led by a different team, but also from the Faculty of Medical Sciences.
Yeah.
For this particular approach, we wanted to create awareness in health professionals and health administrators of various aspects. So it's going to capture three main themes. First, related to policy and administration of health services. We also have a session for education, quality in health education and clinical training. And we also have sessions related to patient care and diagnostic services, because quality is not, sometimes we think only about patient satisfaction, and that's important, but we also have aspects as to how we deliver and how we ensure we're delivering what we say we're supposed to.
Wow. How important is something like this to our country?
Well, health is a resource for the nation. We have a health infrastructure that is delivering care, and there's an opportunity to really deliver care at the highest standard that we can achieve within our resources and best use of our resources.
Right. Have we done any sort of overhaul of our system currently? Are there main areas that we would like to address?
There have been discussions about health reform over the years, and there have been efforts at different agencies and through stakeholders to support and strengthen our healthcare delivery. What's important is that we identify where our gaps are. In our symposium, we won't be able to identify all, but we'll begin to at least start to think about what we can do better, what we may be failing at, or maybe just could be improved, where we're excelling, because you also have to acknowledge where your strengths lie as well as your challenges.
So this symposium would help to identify some of the gaps as well.
Yes, we hope to, because when you think about a model of best practice, you can now say, okay, this could be held as an indicator for where we can be. Are we meeting these? What else can we do better? Are we using these standards? Or maybe we need to revise the current standards. I'm not saying there aren't any, but we may need to just step back and reassess. And that's important for quality improvement. It's always ongoing. It's always about assessing yourself and your system.
Now we have a challenge here, and I'm sure it's not just unique to Trinidad and Tobago, but when it comes to resources and lack of facilities proper, for instance, beds, many times we have a shortage of beds. And how do we begin to address something like that if we're talking about delivering quality?
I would say with understanding your burden of care, understanding how persons utilize your services. So if you think about a community hospital, who are you servicing, and what are the main conditions that you need to address? And are persons transitioning between communities? For instance, our healthcare system, it's pretty much universal access to care. However, we are unable to track patients and to monitor them through the system. So one facility may be overburdened because it's closer, it may be in a main area. However, there may be other facilities they don't know about, or smaller facilities that can deal with less urgent issues, and patients may simply not know what are the services and when they are available. So all these things need to be considered, and that's a process that takes time the regional health authorities are tasked with that, and I don't envy their challenge for them.
So let's talk a little bit about what can we expect at the conference. Who are some of the featured speakers?
Well, we have a range of speakers internationally and regionally and locally. So we've got different keynote speakers for the sessions, but our keynote speaker for health systems and policy is the head of Health Quality Ontario, Chief Executive Officer Dr. Joshua Tepper. His organisation is actually a health advisory board body to the Canadian government in Health Canada, and they really look at some of the things that we've just talked about, looking at how the system works, whether it's meeting the needs, quality measures and quality cycles, and patient engagement. So those kind of models that they're using in provincial Ontario, we think might have some relevance here, and he's going to showcase that for us.
Great.
We also have a professor of medical education, Professor Brandy from Jamaica, who's an expert in quality assurance and accreditation in education. So some of the things that UE are actually working on now to bring us even further into line with international standards and ensure our graduates have the best education. And we also have Dr. Weaver, head of nursing in Jamaica, who's going to tell us about best practice in quality care through the nursing profession. And a range of local speakers from our faculty that are addressing elements of research and clinical care that we think are relevant to quality.
Wow, it sounds pretty intense.
Yes.
How long is the symposium?
Well, for this offering this year will be one day. It starts at 8 a.m. when we start registration, and we expect to close at 4:30, around 5 o'clock. And it's really to start or continue the discussion. And we hope to, from getting feedback from this, from our participants, plan other symposia around themes that are pertinent. So we may be able to identify key issues that jump out at us that would be of immediate need, and then again address maybe through continuing education and future symposia. So that's the plan.
So it will be pretty interactive.
Yes, we have open discussions after the presentations for the audience to really engage with the presentations and bring ideas of their own, and from that we hope to be able to make recommendations and develop way forward.
That sounds great. Who form part of the target audience?
Well, it's largely aimed at health professionals across all the disciplines. So we have representation from medicine, dentistry, nursing, pharmacy, optometry. Just to give you an indication that it's across the board, but we also are happy to have input and attendance from the public who have an interest, obviously, in a major stakeholder in healthcare.
Right.
So we're hoping to bring all those players together, really.
Okay, and is there a cost attached to this event?
Yes, our fee is $500 TT, and it includes refreshments and lunch.
Okay, and what would you like to say to those looking on? Where can they get further information or purchase tickets or that sort of thing, register?
They can email us at fms.conference@sta.ue.edu, and we can send the registration link. And the faculty also has a Facebook page under the Faculty of Medical Sciences, UE St. Augustine, and there's an event page that indicates and provides the program and a link for registration as well.
Great. Any sponsors? Anybody you'd like to mention?
We do have some assistance from InterHealth Canada, and we're teaming up with the Trinidad and Tobago Medical Association to provide credits for health practitioners who are interested in applying.
Great. Professor, closing comments. What would you like to say to those looking on?
Well, we'd be very happy to have all interested members of the public and people with an interest in healthcare quality to attend, and we believe we've got a very interesting event of value, and we think that we can actually make an impact. So we look forward to people attending.
Great. And your closing comments?
It's going to be a challenge. Anytime we decide to think about health and quality and the needs of patients, but I think it needs to begin. And I'm happy that the faculty is taking the lead and being an example in at least reaching out to address the needs of our society in health.
Great. Thank you so much for being here this morning. Very, very informative, and we look forward to this symposium.
Thank you for having us.
Thank you.
So we've been chatting with Dr. Rian Marie Extavor and Professor Raul Naidu on healthcare quality in Trinidad and Tobago, models for best practice.